পৃথিবী জুড়ে ক্রমাগত বাড়ছে পার্কিনসন্স ও মুভমেন্ট ডিসঅর্ডারের মতো অসুখের সংখ্যা। এই উপলক্ষে এশিয়া ওশিয়ানিয়া পার্কিনসন্স অ্যান্ড মুভমেন্ট ডিসঅর্ডার কনফারেন্স অনুষ্ঠিত হলো কলকাতায়। 4 দিন ব্যাপী এই কনফারেন্সের আনুষ্ঠানিক উদ্বোধন করলেন কলকাতার মেয়র ও মাননীয় মন্ত্রী শ্রী ফিরহাদ হাকিম। উপস্থিত ছিলেন রাজ্যের স্বাস্থ্য অধিকর্তা নারায়ণ স্বরূপ নিগম, আইএনকের চেয়ারম্যান প্রফেসর আর.পি. সেনগুপ্ত, আইএনকের ভাইস চেয়ারম্যান ডক্টর ঋষিকেশ কুমার প্রমুখ। মূলত ইন্টারন্যাশনাল পার্কিনসন্স অ্যান্ড মুভমেন্ট ডিসঅর্ডার সোসাইটি (MDS) এবং মুভমেন্ট ডিসঅর্ডার সোসাইটি অফ ইন্ডিয়া (MDSI) এর যৌথ উদ্যোগে এই গ্লোবাল কনফারেন্সের আয়োজন করা হয়। থাইল্যান্ড, তাইওয়ান, ইন্দোনেশিয়া, জাপান, শ্রীলঙ্কা, বাংলাদেশ, অস্ট্রেলিয়া, মধ্যপ্রাচ্য সমস্ত দেশ থেকে প্রায় 700 জন বিশেষজ্ঞ এই গ্লোবাল কনফারেন্সে যোগদান করেন। পার্কিনসন্সের উপর বিভিন্ন সেশন, ওয়ার্কশপ, কেস প্রেজেন্টেশন, ডিবেট অনুষ্ঠিত হয়, যার মূল লক্ষ্য হল বিশ্বব্যাপী অভিজ্ঞতার আদান প্রদান, চিকিৎসার আধুনিকীকরণ এবং মানুষের মধ্যে পার্কিনসন্স বিষয়ে সচেতনতা গড়ে তোলা। কনফারেন্সে পার্কিনসন্স রোগী এবং তাদের কেয়ার গিভারদেরও আমন্ত্রণ জানানো হয় রোগীদের বাস্তব অবস্থা বা পরিস্থিতি তুলে ধরার জন্য। আইএনকের ভাইস চেয়ারম্যান তথা MDSI এর সেক্রেটারি ডক্টর ঋষিকেশ কুমার।
You are here to discuss the new ways how to help the common people, how to help with the new technology the common people come here with the disorder. This disorder, we are privileged that we can afford that, but many people in this world, in this country, in this city are unable to afford when they have their physical disorder. So we need more and more of neurological hospitals, neurological cares. And I thank to Professor Ravin Sengupta.
My name is Victor Fung. I'm the President-elect of the International Parkinson and Movement Disorder Society.
How we can prevent this disease?
So, unfortunately, we currently do not know about what causes Parkinson's disease to be able to prevent it, because, of course, in order to prevent something, one has to understand the causes. However, we do know that there's an increased risk of developing Parkinson's disease the older one gets, and so the current approach would be to do the things that we can do to look after ourselves, to promote healthy aging. So exercise is really important, almost certainly diet and looking after cardiovascular risk, so looking after your blood pressure, diabetes, cholesterol, and these are the things that can be done at the current time to, if not reduce your risk of Parkinson's disease, at least to reduce the risk of developing Parkinson's disease until later in life.
Sir, another question is, I just want to know the treatment. So we know the Botox is the one of the treatment that is used in Parkinson's treatment. So another treatment I just want to know for the Parkinson's.
So, in fact, the major treatment for Parkinson's disease is a drug called levodopa, and the brain converts levodopa into dopamine. In Parkinson's disease, the brain cells that produce dopamine are the main cells that are damaged, and so fortunately, by replacing dopamine, by giving levodopa into as tablets, the brain can then convert that levodopa into dopamine. Interestingly, levodopa was discovered as a medication in the 1960s, but in fact in the ancient Ayurvedic literature it was known that Mucuna pruriens, it was a naturally occurring plant that contained levodopa, and so the old Ayurvedic medicines actually prescribed Mucuna pruriens as a treatment for Parkinson's many hundreds of years ago.
My name is Francisco Cardoso. I am the current president of the International Parkinson's and Movement Disorders Congress. So I came here all the way from Brazil to attend this beautiful congress.
Sir, which pre-symptoms is the awareness create?
That's an important concept, although I have to say that people should not worry about that because this has a great importance, but it's only a scientific importance. So we are trying now to identify people who will develop in the future Parkinson's disease in the hopes that there will be some form of treatment, and we are also working on that, on developing these treatments to prevent these people from developing Parkinson's disease. So that's the whole idea. It can take 15, 20 years, really. So it's a very slowly progressive condition. So this is not a reason for concern.
Sir, is it prevent or cured?
Unfortunately, no, not yet. There are efforts in place to try to come up with treatments that can at least slow down the progression and hopefully to cure the disease. But for those who have Parkinson's disease and are watching us right now, the recommendation that doctors and healthcare professionals now have is please keep exercising. To do exercise definitely slows down the progression of the disease. Talking about during this conference about the very negative role of stigma, people at a global level, it's not only an Indian problem, who receive a diagnosis of Parkinson's disease, they believe that this is the end of their lives, the end of the world, but that's not really the case. With the current treatments that are available, including here in India, people can have a very good quality of life, so they should not hide themselves, so they should try to enjoy themselves, enjoy their families and their lives.
এটা ইউনিক কনফারেন্স, এটা কি হচ্ছে কি বেস্ট অফ দ্য ওয়ার্ল্ড দে অল আর হিয়ার, ঠিক আছে? সো হোয়াট ইজ হ্যাপনিং দ্যাট দে আর শেয়ারিং দেয়ার এক্সপিরিয়েন্স কি দে হাউ দে আর ট্রিটিং পেশেন্ট। আমি শেয়ার করছি মাই এক্সপিরিয়েন্স, হোয়াট আই সিং দ্য প্রবলেম। সো উইথ exchange of ideas, we both are learning. So when I go back to my clinic, I have some more tips. When they go back to the clinic, they have more tips. So in just for everywhere in the world, not only for us, for them also, there will be improvement in the patient care because of this exchange of ideas. They all are coming for conference, but patient should have direct benefit. ঠিক আছে? এটা indirect কি we are learning and then we'll go to the patient. Patient should direct benefit. And patient, they come to me, I treat them. But I wanted to have multiple opinions about one thing. So I thought that we should have all the doctors coming from abroad, the top doctors. They should interact with the patients. So আগামী কাল কি হবে কি about 200 patient caregivers, they'll come to this place, ITC, আর interaction হবে. So short talks, তারপরে question answer, ঠিক আছে? So many times what happens that they have some patient notion কি ইন্ডিয়া में খুব ভালো treatment না. So they can see themselves कि treatment at par আছে throughout the world. Apart from that, who knows, they can learn something. So Agami Kal ke patient program hobe, and all the doctors who are involved there, they're already experienced in talking to the patient. It's a two skill. Ek two skill ache ki treating the patient, talking to the patient. So they are all a skill. So we are very much looking forward. Khub enthusiasm, excitement ache from patient perspective. So that we are doing tomorrow. But apart from that, we are doing a yoga session, a dance therapy session, a monotony bhagwe. It's not that whole day talk. So yoga session ache, dance therapy session ache.